today's topic by introducing something that's very close to my heart. I'm a practicing surgeon in London, but over the last few years, I've really seen the future. We've been talking about patient centricity. But as a patient, have we ever thought what is it that really matters for the patient? The three key challenges are access, availability, and affordability. So I was very touched when earlier I heard speakers talking about how they could not access the right specialist at the right time and how the data needs to flow. However, the future is much closer than what we think. So I'm just going to show you something in the next minute or two, but the key theme is extremely simple. That future is going to be patient-centric, whether we like it or not, but data is going to make a huge transformation. Our current model is provider-centric. We've got hospitals, clinics, primary care, secondary care, tertiary care. As we go ahead, this model is likely to get disrupted because AI is making access to healthcare extremely simple, and it is underpinned by accessibility things like health ATMs and a global clinician network. Let me talk about this. I'm going to show you something. Now, if you watch the screen, you'll see something very magical happening.
Welcome to our teleconsultation. I'm here to help you with your health concerns. Can you please tell me a little bit about what brings you here today? What symptoms are you experiencing and how long have you been experiencing them?
I've suddenly started noticing some tummy pain. It started around the belly button, but then it moved to the right hand side. Also, I'm feeling a bit feverish and I've lost my appetite completely.
Tummy pain can be caused by many things. You mentioned it started around your belly button and then moved to the right side. That's an interesting pattern. Can you tell me more about the pain? Is it constant, sharp, dull, or does it come and go? And have you experienced any other symptoms like nausea, vomiting, or changes in your bowel movements?
It's a very sharp pain which gets worse when I move around. It's okay when I sleep. I have been nauseous and I've also vomited once. I've not opened my bowels.
A sharp pain that worsens with movement suggests it might be related to the peritoneum, a thin layer of tissue surrounding the abdominal cavity. The fact that you've vomited and haven't had a bowel movement could indicate that there's some sort of blockage or obstruction. I'm also concerned that the pain moved from the belly button to the right side, which might suggest an issue with the appendix. Can you tell me, have you had any similar episodes of pain in the past or any recent injuries to the abdominal area?
Not really. I've never had this pain in the past. This is just all very sudden for me.
Since you're experiencing sudden and severe symptoms, I'm going to advise you to seek immediate medical attention. The combination of sharp abdominal pain, nausea, vomiting, and fever suggests that this could be an urgent condition that requires further evaluation and treatment. I'm concerned about the possibility of appendicitis, a blockage, or another serious condition. Considering it's a teleconsultation, I'd like to recommend that you visit your nearest emergency room or urgent care center as soon as possible. They will be able to perform a physical examination, take your medical history, and possibly order imaging tests such as a CT scan or ultrasound to diagnose the cause of your symptoms. In the meantime, please try to stay calm and hydrated by drinking plenty of fluids. Avoid eating or drinking anything heavy until you've been evaluated by a doctor. We'll also need to consider emergency surgery if it's indeed appendicitis. Is there someone who can accompany you to the hospital, or do you need assistance with transportation?
I would appreciate some help.
I'm going to go ahead and arrange for an emergency service to assist with your transportation to the hospital. Please wait for a call from our team to confirm the arrangements. In the meantime, I'd like to summarize the key points of our conversation. You've been experiencing sudden and severe abdominal pain, starting around the belly button and moving to the right side. The pain is sharp and worsens with movement, accompanied by nausea, vomiting, and fever. You haven't had a bowel movement and have lost your appetite completely. You've never experienced this type of pain before, and there's no recent history of abdominal injury. Considering the severity of your symptoms, it's essential to get you to the hospital as quickly and safely as possible. We'll be in touch regularly to ensure that everything is going smoothly. Please stay calm, and help will be on the way soon. We'll also provide you with a referral to the emergency department so they can receive your information and be prepared to treat you upon arrival. Is there anything else you'd like to discuss or ask before we conclude this consultation?
Can you do the summary in Hindi because I'm in Delhi?
मैं समझता हूँ। आइए, मैं अपने योगदान का सारांश आपके लिए हिंदी में करूँगा। आपके लक्षणों के लिए हमें सर्जरी की आवश्यकता हो सकती है, इसलिए मैं आपको फौरन अस्पताल जाने की सलाह दे रहा हूँ। हम आपकी सुविधा के लिए इमरजेंसी सर्विस की व्यवस्था करेंगे। हमारी बातचीत के मुख्य बिंदु यह हैं: आपको पेट में अचानक दर्द हो रहा है।
Hello, doctor. So let me tell you that these are properly trained medical models, privately hosted, secure, and up to the minute in their knowledge basis. That previous GP did not just get my history. Today he has the ability to actually check me out. He can do my vitals by looking at me. He can listen to my abdominal sounds. He can look into my eyes, look at the back of my throat, actually examine me. Now, how is that possible? Guys, I want you to pause. This is the future. The future is not human-led. The future is data-led. When I said that's a general practitioner, but there's a gastroenterologist who looks like me. And if I on him, you'll think you're speaking with me. He'll speak in my voice. He will actually be the most trained gastroenterologist you'll ever find. But these are just avatars, and these just are the medical ones. What about non-medical? Today, the truth is any role in your hospital, any role, except for direct interventional roles, we can integrate them with your own hospital system. You don't need a receptionist. You don't need a patient advisor. You don't need a clinical nurse. You don't need a triage nurse. Because all those roles can now be done with AI. What I can also tell you is that the bot can speak every language in the world. Imagine a receptionist. You have an Arab patient walking into your hospital and she starts speaking with him in fluent Arabic. And then the next patient is a Thai patient and she speaks in Thai. So this is where we are heading. Now, I mentioned that there's something else that's happening, and that this is known as data triangulation. So the next part that's happening.
Initial vitals examination. Your vitals will be checked. Initial vitals examination.
So I just wanted to show you the health ATM. There's a home ATM. But the concept is exactly as we mentioned earlier, that if my doctor of any specialty is available to me on an ATM, and he can examine me, he's looking at me and he's telling me, oh, I think you have an nystagmus. I think there's a balance issue. Can you stand up in front of me and do a Romberg's test? And the truth is, he actually can interpret it. The health ATM is a device which actually collects all your data, whether it's audio data, video data, or even interpret your tests. And this is the home part of it. So tomorrow, if you have an elderly person who's not really capable of mobility, the exact same thing can be replicated at home. Now, this is all real, this is all working, this is already deployed, this has already been validated. We validated it against 2000 test cases. The human eval was 84% accuracy. The bot was 96% accurate. So we are talking about leaps and bounds of accuracy. We all are fallible. The data tells me that 14% of our clinical episodes have an error in it. Our errors alone globally cost $1 trillion. Any healthcare provider that today is thinking that I'm just going to augment a hospital or a clinic needs to rethink. These ATMs are backed by a global clinician network. So now it's going to be very easy for me to sit in Delhi and get an opinion from Mayo or Cleveland, or an American patient to take an opinion from Metro or Yashoda because I can see you here. So globalization of healthcare access is where the game lies. Remember, a consultation in the US today is minimum $350. You offer it at $50 or $60, they're going to be queuing up for that consult. But the reason I was mentioning earlier is this is all about data connectivity and a clinician network augmented with AI. There's a question I often get asked: what if the AI makes an error? Two things. The whole framework is such that it doesn't make an error, but despite that, for legal purposes, every AI decision is actually passed to a human just for evaluation. So we have doctors who only supervise the decision, they don't have to see the patient. They just ensure that the decision making is robust. So I'm going to conclude with a very, very simple statement that AI is here and it's real. We all need to be a part of a global network, because if we are a part of the global network, not only will we benefit from it, but it will actually be very relevant. We talk about patient centricity, but nothing is more central than simply giving access to healthcare from wherever the patient is. And my last passion, I'm creating this network as we speak. It's called the Axonic Network. We started our own clinics in UK and in India. But my simple appeal is, whoever is interested in AI in healthcare, I'll be very open to talk with them. Thank you very much.